Okay. Welcome, everyone. Good afternoon, or good evening, or good morning. Thank you for joining us today. I'm Ana Maria Napoleão. I'm a nursing professor at Universidade Federal de São Carlos, Brazil, Director of Education at NANDA International, and I'm here on behalf of Professor Silvia Caldeira from Portugal, who is Director of Research at NANDA International. Professor Silvia organized this webinar series called Research on Clinical Validity. So today our speaker is Professor Marcos Lopes. Professor Marcos is a nurse, master and PhD in nursing, as well as a statistician and psychologist. He is associate professor at Universidade Federal do Ceará, Brazil, and member of the Nursing Process Research Network, Brazil. He is also fellow and member of the research committee at NANDA International, and he has been dedicated to the development of nursing diagnosis validation studies for the last 20 years. Before we start the webinar, I'd like to say that if you have any questions, you can use the question and answer function that is available in the bottom of the screen. And in the end of the seminar, Professor Marcos will try to answer them. Professor Marcos, thank you so much for joining us today. We are honored and grateful to have you here. If you need any assistance, feel free to let me know. So be very welcome. I give the floor to you now.
Thank you, Professor Ana Maria. And good morning, good evening, good afternoon for all. And it's a pleasure to stay here with you. And today we discuss some topics about research on clinical validity. I'm Marcos Lopes. Professor Ana Maria was present with me, and this presentation was developed with the assistance to Professor Viviane Silva. But Professor Viviane Silva has other meeting now in the same hour, so she can be with us, but I will present this STEM for you. Okay. Our presentation has three objectives today. The first objective is to exemplify research questions in clinical validity of nursing diagnosis. And our second objective is to describe research methods used to obtain evidence of clinical validity of nursing diagnosis. And the last objective will be to present examples of studies using different methods of clinical validity of nursing diagnosis. Unfortunately, we have only 1 hour, so we have few time to detail each method. So maybe we present a resume of each method, okay? But we can maintain a contact, posterior contact for email if you have interest into speaking about this. Okay. In the recent book, we have this book in Amazon to sale now, and we have three levels of development of a nursing diagnosis for NANDA. Okay, we have a concept generation as a initial level with this level the researcher present label definitions of diagnostic components, but there is no research yet. The research starts with the second level, to theoretical support. In this level, we have conceptual and diagnostic content studies. Today, we explain the last level, the clinical support. And in this level, we have 10 different sublevels, okay? We have a sublevel including qualitative studies, demographic studies, construct validity, selective validity, discriminant validity, prognostic validity, generalizable validity. and 3 sublevels related to causal factors. So is this last level we will present for you. So we have a lot of different methods to describe today. So we have few time, but I will try to resume in a more clear way as possible for me. Okay? So to our first objective, we have some examples here of research questions we can develop in different designs to obtain evidence of clinical validity for nursing diagnosis. In our first example, we have how do patients report their spiritual experience with a specific disease. Here, our objective was related to individual experiences. So this research question is related to qualitative validity, qualitative study. And the second example we have what social demographic factors are associated with excessive sedentary behaviors among teenagers. Here we have a study dedicated to found relation between causal factors and the nursing diagnosis. And these causal factors are specific population at risk or associated conditions. So we define this kind of study with demographic validity in this book, in NANDA's book. Okay. Have an example about constructive validity. This question is the main question to the clinical support level. Okay, and here we have, for example, as example, the question: what clinical indicators allow an accurate diagnostic inference of ineffective health management in people with hypertension? So here we have a research question related to obtain measures like sensitivity, specificity, predictive or negative values. The fourth example is related to situations when we need to make fast decisions. So this example is an example of selective validity. So we have what clinical indicators allow the selection of patients with COVID-19 for immediate initiation of oxygen therapy. Here we have a common situation in emergency rooms, for example, during the pandemic situation. And the next, we have an example related to discriminant validity. So we have what clinical indicator allows us to differentiate the state of impaired gas exchange from other respiratory diagnoses among children with respiratory infection. The objective here is differentiate 2 or more nursing diagnoses that share the same or some defining characteristics. Okay. Next, we have an example of research question directed to identifying clinical indicators related to a prognostic situation, okay, the deterioration of state of the patient. So our example is what clinical indicators are prognostic markers of delayed surgical recovery in patients undergoing cardiac surgery. And the next, we have an example of studies dedicated to identifying clinical indicators expressed by different populations. So we have here a generalization aspect of validity. So the example is what clinical indicators of an effective airway clearance have a high level of accuracy among patients with different clinical conditions. And the last example of research questions, we have an example related to causal factors. So we have what clinical factors can initiate, reinforce, or predispose to the impaired comfort among children with cancer. So these questions represent the complexity we have today in research of nursing diagnosis. Some years ago, the research of nursing diagnosis was limited to structure of the nursing diagnosis based on Fering's method. Today, we have a lot of different ways to research in nursing diagnosis. And this is very interesting because we can, a lot of different problems we can solve using the research based on nursing diagnosis. So before to present each method, I need to clear an important aspect in research on clinical validity of nursing diagnosis. In general, I use the term to reference standards to indicate a perfect method to identify a nursing diagnosis. The problem is, in general, there isn't perfect reference standard for the most nursing diagnoses because most nursing diagnoses we have are psychosocial nursing diagnoses. And even in physiological nursing diagnosis, in general, we don't have perfect reference standards. So we need to use other strategies to make our inference, diagnostic inference, and to use this diagnostic inference to verify the validity of elements of the structure of the nursing diagnosis, okay? So some options are patients. For example, in qualitative studies, we use the experience of patients like our reference standard and compare the reports of the patients with our expectations of the nursing diagnosis. Other strategy is the use of panel of experts. It's very common. Fering's method is based on one expert. Is a more simple panel of experts, is a panel with only one expert. So, but there are some studies using 2 or 3 experts develop the diagnostic inference. Yeah. And more recently, we have some studies use the latent variable theory. The latent variable theory describes that an unobservable latent variable determines the relations between observable variables. Okay, so we don't need to make an inference, but we start the relation between the association between defining characteristics like determined but latent or not observable variable, unobservable variable. Sorry, my English is not good, okay? And we have the fourth strategy is the use of predefined roles. This strategy is used when we develop causal studies. So we need to previous studies about the clinical characteristics in terms of sensitivity or specificity, and determine a rule to identify people with or without a nursing diagnosis. So we can use 2 defining characteristics with high sensitivity and 1 characteristic at least with high specificity. So we can use this rule to determine the presence of the nursing diagnosis. Of course, the last strategy we can use with previous studies with defining characteristics. If you use these options, we have this article published in 2006, I think, by Rutges and colleagues. In this article, this team presented a description of each strategy. Okay, so we can start our describe of each method now. So qualitative validity is a study to generate evidence that clinical elements of a specific nursing diagnosis are experienced by individuals. So here, this kind of study is very interesting because we can use the expressions of emotions, cognitive aspects, perceptions, existential concerns, and compare this data with our expectations about the defining characteristics presented by the patients. Okay, so the design classic here is the qualitative. So we can use different kinds of qualitative analysis like ethnographic analysis, content analysis, grounded theory. It depends on the kind of nursing diagnosis. If you have a nursing diagnosis more depends on the culture, for example, we can use ethnographic study, for example. If you have a nursing diagnosis related to existential problems, existential questions, we can use a phenomenological study, for example. Okay, so here the reference standards is the expressions of each patient included in our study here. Here we have two examples of this kind of study. Okay, the first example is from Portuguese team. We have Professor Silvia Caldeira here, one of the authors. Right? And this study is very interesting because these studies try to extract some informations about the experience of patients to analyze the implications for the nursing diagnosis related comfort. And the authors present an interesting conclusion that the impaired comfort nursing diagnosis can be a syndrome. It's very interesting, this conclusion. And the second example, we have Iranian study developed by Lydia Nick Faraday. I'm sorry if my pronunciation is not good, okay? But Lydia Nick Faraday and some colleagues developed qualitative studies about psychosocial nursing diagnosis in mothers of children with cancer. It's very interesting. Both studies use for analysis the content analysis, okay, based on interviews. So this is very interesting examples of qualitative validity for nursing diagnosis. Oops. For demographic validity, we have the objective to generate evidence that demographic characteristics of a population can influence the interpretation obtained from the diagnostic components. Here we have concern or attention, we need to pay attention because this kind of validity has a strong relationship with causal components. In general, in this study, we extract the relation between some demographic characteristics and the expression of the nursing diagnosis. In general, these associated factors are not modified by nursing work, by nursing intervention, but the generated information here can be assisted us to define specific strategy for specific groups. For example, if the body image is more common affected in women, for example, or for different ways, we can develop specific strategies for women and for men. In general, the design used here is a cross-sectional study, and we can use for reference the standard panel of experts or the latent variable theory. Okay? In the analysis, we have a lot of different aspects. In here, we have exploratory analysis here. We have association tests, mean difference, magnitude measurements like prevalence ratio, or we can use more advanced statistical analysis like hierarchical modeling based on logistic regression or Poisson regression and other analysis. Here we have two examples, okay, of demographic validity. We have one study developing in school students, secondary school students, about sedentary lifestyle. This nursing diagnosis changed the title, the label, to excessive sedentary behaviors in the new edition. So it's very interesting, no? And in this study, we use the Mantel-Hansel analysis to identify subgroups. For example, if related factors has different magnitude effect on gender, for example. So we found some difference related to gender here. And the second example, we have a more previous study, I think in 2006 or 2007, published. And this article developed studies with a set of nursing diagnoses expressed by patients with high blood pressure, and we analyze the relation of this nursing diagnosis with demographic characteristics. Okay. The next level is the most important level of clinical validity. The expectation of us is all nursing diagnosis can be stay in this level at least. Okay? This evidence level includes studies to generate evidence that a set of defining characteristics allows the correct interpretation, inference of the nursing diagnosis for a defined clinical context. Okay? The design is typically a design for diagnostic accuracy study with naturalistic sampling. Naturalistic sampling is a sampling based on a consecutive, how can I say, the people are included consecutively. I identify the profile, okay? And the reference standard here, we can use panel of experts or latent variable theory here. And the analysis is based on diagnostic accurate measurements like sensitivity, specificity, calculation of posterior probabilities. And this is very important, this topic, because the posterior probabilities represents the inference developed based on the different sets of defining characteristics identified in the study. So in this kind of study, we don't make inference, diagnostic inference by experts or independent analysts, but the inference is based on the association among the defining characteristics. Okay. We need to present fit statistical tests to verify if our model based on hash models or latent class analysis are adequate adjustment, and we can develop stratified analysis. So we have a lot of different analysis to proceed here. If you're interested into to know these methods, I'm present to you 3 different articles using 3 different methods for clinical constructive validity. The first, we have a study about spiritual distress using rash analysis or rash model. Or rash analysis is one kind of IRT model, or eating theory response model. Okay, in this study, just a Portuguese study by Professor Silvia Caldeira and with doctoral student Joana Romero about the spiritual distress. So they use rush methods to identify a specific model to this nursing diagnosis. The second example was developed in Brazil here with my team using latent class analysis. Latent class analysis as a specific method to identify sensitivities and specificities for each defining characteristic based on latent theory model, latent model, okay? And in this study, we calculate the accuracy measures for ineffective breath pattern in children and adolescents with congenital heart disease. And the next example, we have a study using Ferg's model by Spanish team, okay, by Olga Paloma and Jose Manuel Romero. As I know these guys. I know Jose Manuel Romero is a good guy. And they developed this study about grieving in perinatal loss using the Ferg's model. Okay. So here we have 3 examples you can read to know better, to know this kind of analysis. The other methods, the other kind of validity in NANDA International is selective validity. This kind of validity is useful to situations we need to fast decision, okay, like emergency rooms, for example. So the objective is to generate evidence that a minimum set of defining characteristics can be used in a heuristic manner for a minimally acceptable interpretation of the presence of a nursing diagnosis. That is, I need to fast decision using a small group of defining characteristics. This is very common in situations like like in emergency room, for example. In general, this study is using a cross-sectional design. Okay? And the reference standard can be pi of expert or latent variable too. And the analysis is based on a specific technique named classification tree. Okay? And we have here 2 examples using classification tree for selective validity. The first example, we have a classification tree for ineffective airway clearance for children with respiratory infection, okay? And the second example, we have classification tree for fluid volume excess in patient on hemodialysis. Okay? So both studies found a minimal set to make decisions based on limited number of defining characteristics. The next kind of validity, we have discriminate validity. In this kind of validity, we have our objective is to determine the set of defining characteristics that allow for differentiation between diagnoses that share similar signs and symptoms. This is differentiation. So we need 2 or more nursing diagnoses share the same defining characteristic or a great number of defining characteristics, And we need to construct a structure to differentiate between these nursing diagnoses. Okay? Ferengi present a model to make a study about differentiation between nursing diagnoses, but I know only one article using the method Ferengi to this objective. Recently, there is other methods to use it by differentiation between nursing diagnoses. In general, these new methods use a cross-sectional design and can be used a panel of experts, but the most common is the judgment based on latent variable techniques. So we have we can use to analyze different techniques like multiple correspondence analysis, hierarchical cluster analysis, latent class analysis, fuzzy logic. So these are very complex methods, and we have some care to use these methods because sometimes we can't find a good solution, and the things can be more confused here. So here we have 3 examples using 3 different methods to differentiate nursing diagnosis. The first example use multiple correspondent analysis, okay, for differentiate 3 different nursing diagnoses: the ineffective airway clearance, the ineffective breath pattern, and impaired gas exchange with children with respiratory infection. The second examples use fuzzy logic. Fuzzy logic is a technique based on a diffuse set theory. Okay, this study used this technique to differentiate the nursing diagnosis related to urinary elimination. And the third example, we have a different aspect of this kind of validity. In this article, the objective was not to differentiate two nursing diagnoses, but the objective was the opposite, is to prove there is no difference between two nursing diagnoses. Here we develop an animation analysis between situational low self-esteem and chronic low self-esteem. Okay, here we use the rationales to prove the unidimensional between the unidimensional of this nursing diagnosis. Okay. The next valid kind of validity, we have the prognostic validity. This is a very interesting method, but this is more complex method in compared to other previous methods, because these methods we need to a cohort study. We need a follow-up patients for a specific time, and this time depends on the kind of nursing diagnosis. If you have a acute nursing diagnosis with short time to development, maybe the time is short. But if you have a chronic evolution of the nursing diagnosis, we need more time. So we can some problems with if we need to follow patients with a long time. Problems related to time to conclude, financial problems, research. We need time to training to the team. Okay, so the objective of this kind of validity is to generate evidence that a specific set of defining characteristics supports the interpretation of a patient's clinical deterioration related to a nursing diagnosis in a specific context. So the objective here is to analyze the deterioration of the patient. So I have signals, previous signals, early signals indicated to deterioration of clinical status of my patient. If I have this interest, I need to develop a prognostic study. So I need a design based on cohorts. The reference standard here can be kind of expert and latent variable too, but the analysis is very different because our analysis will be based on life tables, based maybe Nelson Allen, and I don't remember now. If I remember, I speak for you. Kaplan-Meier, I'm sorry, Kaplan-Meier method or Nelson Allen method to construct life tables. And we can use a lot of different models named Cox models. Okay, Cox models are regression models to use to determine what variables are related to early expression of a nursing diagnosis. Here we have three examples. These examples all use analysis based on survival analysis, life tables, Cox models, etc. So the first example, we have a study about hyperbilirubinemia in neonatal patients. And this was development during 7 days. It's a short time because hyperbilirubinemia, I'm sorry, is a phenomenon with short time. So it's possible to make this analysis. And the second study was developed to identify prognostic indicators of delayed surgical recovery in patients undergoing cardiac surgery. Here we have follow-up time of 1 year, I think, okay, and using Kaplan-Meier methods. So we have different times in these studies. No? And the third example, we have prognostic indicators of short-time survival for an effective brief pattern. Here we have a short time too. We have a follow time of 10 days only, and an extended Cox model was adjusted to identify main prognostical clinical indicators for this nursing diagnosis. Okay, so this example uses the same techniques, but different times based on, of course, the specific nursing diagnosis and contexts. The next kind of validity is generalizable validity of defining characteristics. Here, this is the most complicated kind of validity to develop because we need to develop a systematic review of studies developed to specific nursing diagnosis using the same operational definitions for the same defining characteristics. So this is very hard to find a set of articles using the same things. Okay, but we have some examples, but we have few studies with this approach. So the objective here is to identify clinical signs or symptoms that allow for a generalized interpretation of the nursing diagnosis across populations. So the same defined characteristics can be in the same properties of sensitivity or specificity for different populations, for children, for elderly, for men, for women, for people with high blood pressure, for people with infections, etc. Okay, so the design a systematic review of meta-analysis. But I think this is very, very hard to found a minimal set of articles to develop a meta-analysis here. If you have the condition to found the set of these articles, you develop a study similar to systematic review with analysis. You can use odds, you can use summary of odds ratio, believe in negative likelihood ratios, okay? And the GBI initiative had a chapter about specific systematic review for diagnostic tests, but in the last manual published this year, this chapter was retired. There is no this chapter, okay? And the GBI recommends the use of the chapter of Cochrane manual about diagnostic tests. Okay, if you need material to study this systematic review, today we have the Cochrane manual. Here we have 3 examples, okay, of the generalizable validity of defined characteristic. Look, these articles use a small number of studies. For example, the first study about ineffective array clearance found only 7 articles. Okay, 7 is a small number. The second, published in Italian and about gas exchange, work with only 3 studies. For some defined characteristics, only 2 studies. And the last study about an effective break pattern used 6 studies on. Well, so, and the systematic review don't have don't work with time limited, for example, time limited by language, and use it all time, all language. We found 7, 3, and 6 articles. We have, and not all defining characteristics can be analyzed because some studies don't use all defining characteristics. So for some characteristics we use 7, others 5, other 4. So we have some difficulties to develop this study. And and the last of kind of validity is causal validity. Here, we have few studies yet because our research remains concentrated in defining characteristics. This is important, of course, because defining characteristic is the main element to the diagnostic structure. But the causal factors like related factors, risk factors, population at risk, associated conditions are important because our interventions may be related, maybe defined based on the causal factor. But so we need to develop more studies about causal factors. This kind of validity is related to is the objective of this kind of validity is to generate evidence of a causal relationship between one or more factors in the nursing diagnosis. We can 2 kinds of studies here. We have case control studies. Case controls studies are used when we have defined a multiple related factors for a specific nursing diagnosis. And we have cohort studies when our interest is identify multiple nursing diagnoses related to the same related factor. So today we start our interest for causal relations. So the most studies in causal validity are case control studies, because in general, our interest is to identify different related factors to the same nursing diagnosis. In the future, maybe we can change to cohort studies when we identify the same same related factors and the consequence related, they exposed to the same related factor. Okay. In both studies, we can use like reference standard, the panel of experts, latent variable, or predefined clinical roles. Here we can use the third aspect to defining reference standard. And the analysis, of course, can be changed independent on the design, okay, case control or cohort studies, but the analysis can include association measures, effect magnitude measures, if you have case control or cohort studies. And if you develop a cohort study, you can calculate incident ratios too. Here we have two examples using this specific causal validity. Okay, both are case control studies. We can see here. Okay, the first is a case control study to the nurse diagnose risk for delayed surgical recovery, and the second is the case control study for the pressure ulcer risk. Okay, look, both studies are developed to risk diagnosis. Okay, really. So if you develop a validation of a nurse risk nurse diagnosis, in general, the design used will be case control. Okay. And there is a lot of different use of nursing diagnosis in research. Here we have three examples, not related to validity of nursing diagnosis, like present in NANDA International book, but they are interesting researches to read and to verify the application of nursing diagnosis. The first study is a study developed by Italian team with Professor Fabio D'Agostino. Professor Fabio will present the next seminar for you. Will be interesting too. And Professor Gianfranco Sanson. They are two guys dedicated to study of the nursing diagnosis as predictors of different outcomes, nursing outcomes. And this study specifically was developed to identify the nursing diagnosis as predictors of hospital length stay. And they are found interesting results in the nursing diagnosis can be affected the length of stay of the patients. The second study is very interesting cluster analysis about nursing diagnosis in pre-hospital emergency. The study was developed by Spanish team too. Here we have Jose Manuel too. And this study finds some groups of nursing diagnosis related to different groups, okay, based on cluster analysis. And the third, we have a very interesting randomized trial based on cluster analysis too, but not the same cluster analysis of the previous studies. Another technique is a technique of randomization. And this study was developed by Maria Miller-Staub in Switzerland. No? And the three studies are based on records, and this is the main concern we need here. When I develop studies based on records, we need to verify the quality of records. In all these studies, this is what was very interesting work by the teams. Okay, but we have here 3 different examples of the more common researches we have of nursing diagnosis. But I think this is our 3 very interesting researches. To finalize our presentation, we have three things to show for you. The first is there is a wide variety. I think you realize here, no? There is a wide variety of important and complex methods required to validate diagnostic interpretations in different contexts and applications and for different objectives, okay? And the NANDA International works to improve our methods, our classification, to found evidence, clinical evidence for support our nursing diagnosis, to make best decision to produce best outcomes. And we need to remember scientific advancement in nursing depends on all of us, okay? So we need to contribute. So go ahead, please contribute with us. Thank you so much. And this is my contact and contact of Professor Viviane. If you have questions, I am on stage to collaborate with you. And thank you so much for your attention.
Thank you very much, Professor Marcos, for this brilliant, amazing presentation. I don't know, we have one question here. Congratulations and thank you for your presentation. If you have any questions, please, you can write here. Professor, I have one question for you. I'll try to read it, and I hope you can understand me, because I don't know if I am clear. But what is the recommendation for constructing instruments to do nursing diagnosis validation studies? I have doubts about the instruments. What's the reference for us to construct these instruments?
Instruments to use in the research to validate nursing diagnosis?
Yes. For example, we have nursing diagnoses. There are very specific, like ineffective airway clearance, for example, but we have some nursing diagnoses that are most general, like low self-esteem. Okay. So I'd like to know, if I do an observational study using validated scales that are general, like Rosenberg's scale, could I validate a nursing diagnosis using this kind of instrument scale?
Okay, I understand your question. It's a very interesting question. Look, we have some problems here. And firstly, some nursing diagnoses can be experienced or expressed in different ways, in different contexts, for different patients. So when we develop a study, we need to consider the context, okay, when we use the inference. For example, the self-esteem is expressed differently between children and adolescent and elderly, for example. So maybe we need different structures of nursing diagnosis to use for different populations. So if you need to validity nursing diagnosis of self-esteem, for example, firstly, we need self-esteem for who? Children or elderly or women with breast cancer, for example. If you define the clinical population, we need to develop a systematic review to identify signs and symptoms related to the specific population, to compare with NANDA list, okay, and to adjust the final list, including your finds and the NANDA list, and to create operational definitions for each element, and in this structure to use to collect data. Okay, it's not good to use private instruments because in general these private studies are not submitted to a clinical validation. I don't know if these instruments are adequate to use in different populations. And the NANDA structure has specific characteristics. We have defining characteristics treated are dichotomic variable. No, it's present or absent. So we have different techniques to identify the importance, the sensitivity or specificity. This occur for the most of the nursing diagnosis because we have a lot of psychosocial nursing diagnosis. In psychology, for example, we have psychological tests, but the psychological test needs to submit to different research about validity. So in psychology, we have one instrument with validity to children, to adults, but we don't have studies of validity by teenagers, for example. So I can't use this instrument to adolescents. I need firstly to develop study. So my recommendation is study the elements for each nursing diagnosis for each specific population based on defined operational definitions. Okay, maybe we can more successful with your research, your work. Okay, I don't know if I clear because my English is not good. I'm sorry. Okay.
Not a problem. Thank you, Professor. We have a question here from Stefan Brunner. Greetings from Germany. Thank you very much. NANDA states in the new 2024 version, further research is critical that provides information on which assessment indicators are most predictive of a patient developing a condition which is represented by a nursing diagnosis. This will allow us to narrow the list of clinical indicators or separate the lists into critical defining characteristics, or those that must be present to make a diagnosis and supportive disease. Likewise, there has been little focus on related factors and/or risk factors for nursing diagnosis in research studies, yet it is these indicators that should primarily drive intervention. Thus, we strongly support studies which provide nurses with information on which related factors are most critical for diagnosis so that intervention studies can be undertaken to remove or minimize the effects of the causes or risk factors for a diagnosis. To what kind of validity study refers NANDA here?
Yes, good questions. Is the last level, sub-level, okay, is causal validity. NANDA recommends the studies about related factors, risk factors, associated conditions, population at risk. And in general, we can use case control or cohort studies. And here there is more, not indirectly recommendation. This recommendation is after identifying the causal factors, okay, we need to study how we can remove these related factors to produce the best outcome of nursing, okay? So directly is the causal validity, but we need other thing to thinking, that is, how can you remove this related factor to produce best outcomes, okay? And Stefan Brunner presents the second question. If I may, what kind of validity studies do you find the most needed and urgent? It depends, Stefan, depends on the nursing diagnosis. We have some nursing diagnosis, we don't have, we have a weakness evidence. So we need sometimes the conceptual evidence, the content validity, okay? But we need at least the constructive validity. This is our focus here because we have information about clinical validity of each nursing diagnosis. But we have a lot of different nursing diagnoses with different evidence levels, okay?
Just for us to remember, Professor, constructive validity can be with panelists, with the I study with the panelists, with a panel of experts.
The constructibility is a clinical support, is at the level, I think, 2.3. I'm not sure here. Is the study based on clinical validation. So we need to calculate specificity, sensitivity, is this kind of validity.
Okay. I think that's all. Can we finish, Professor? Something more you'd like to say?
No, I'm very grateful to this opportunity, and if there is someone interested to contact me, if it's a pleasure to talking about this, and thank you for your attention today.
Thank you, Professor Marcos. Thank you again for the brilliant presentation. It's a pleasure to have you here with us. So I think we can conclude the webinar. Thank you all for attending. So bye-bye.
Goodbye, everyone.